So we have the media and the educational institutions been really controlling the narrative and defining the terms. So let's just first get some of these terminology out of the way, because people are going to hear us talk about this and they're going to think, oh, they're talking about conversion therapy. So, and I know we hate that term. And why is that? When people use the term conversion therapy, what do they mean? What do you say when you hear conversion therapy? What do you think that people are talking about when they say
I don't know. That's I always ask them, what's conversion therapy?
Yep.
That's always how I respond to it, because I really don't know what conversion therapy is. I remember the first time someone asked me when they found out that I, was in the practice of honoring people's values and their self-determination around their sexuality. And they asked me, oh, do you do conversion therapy? I'm like, what is that? I literally never had heard of it. This was decades ago, but I still don't know what it is.
Yeah. And Dr. Nicolosi, conversion therapy, what is the understanding that you come across?
The term conversion therapy is broad, ill-defined. There's no ethics code, no governing body. It could be practiced by somebody who's unlicensed. It's an infinitely malleable term with no meaning. I prefer to stick with the scientific terms. And what Dr. Pela did in her study, we examined reintegrative therapy. It's part of the U.S. Patent and Trademark Office. It's a registered term. It's a very specific protocol published in the Journal of Human Sexuality. It treats traumatic memories. Sexuality change is the byproduct, not the goal. And that's one of many distinguishing characteristics. There are 12 or 13 distinctions between so-called conversion therapy and reintegrative therapy, and they're all listed on reintegrativetherapy.com. Click on About Us, and you'll find them all there.
In 2012, when California passed their ban for therapy for minors, they used the term SOCE, and that's been floating around there as well. SOCE being sexual orientation change efforts. And let's just quickly define that. That's too broad as well, because that includes not just therapy, but also like support groups or self-help or pastoral counseling, religious mediation. And so at the Alliance for Therapeutic Choice and Scientific Integrity, we don't even prefer to use SOCE. We prefer another term, safety. So Carolyn, could you define safety and what that stands for?
Yeah, it's sexual attraction, fluidity, exploration, and therapy. So it's a very different concept than, in my opinion, sexual orientation change efforts. First of all, sexual orientation change efforts assume that sexual orientation exists, and there's very little evidence to show that people are born with sexual erotic attractions of any kind. And so, and we could go on and on about that, but I just prefer the idea. And again, it's congruent with my practice that it's an exploration process. It's led by the client. It's not efforts. I don't like that word. It's like, let's try to do this. It's like a beautiful exploration process of discovery. And when we support client autonomy and self-determination, the research on that shows that even just the process, as long as they're supported in that and put in the center, even regardless of where they end up in their fluidity exploration, their well-being is increased. Yeah. So
what I like too about safety is it's broad, and so that it includes all sorts of therapeutic models,
right?
But it's also very precise, so it's exclusive, so it only includes professional therapy approaches,
right?
It's not including these self-help approaches or people reading a book or going to a seminar or going to a pastor. Not that we are against people seeking religious approaches, but we want to narrow it down when we're talking about therapy, because most of the bans that we've been seeing over the past 10 years have been specifically for licensed therapists or psychologists. And so we need to show, well, if we just narrow it down to that, what are we talking about? What do we see? So it's broad, it includes multiple approaches, of which reintegrative therapy is one of the approaches, but not the only one. There's another term that gets conflated with conversion therapy, and that is reparative therapy. And I think it's helpful for us to quickly define what actual reparative therapy was. Joseph, could you briefly give us an explanation when, because of the fact that your father is the founder of legitimate reparative therapy, could you explain how that's different from conversion therapy?
I should have a more precise definition because I own the trademark for that term also. And even I don't remember off the top of my head the exact definition, but it's something akin to the ideas that my father put forth. And he was developing this idea over time, reparative drive theory, reparative therapy, in his book, Shame and Attachment Loss. That's probably where it is. That's probably the closest thing you'll find to a codex for that. But it was his ideas, his developmental theories based on the psychodynamic understandings, and using a lot of the psychodynamic framework at understanding the development of same-sex attractions as it pertains to men.
Yeah. And unfortunately, so many people have taken that term and they've misused it, misapplied it, so that anyone who is counseling anyone for unwanted same-sex attraction now calls himself a reparative therapist. And it just got to the point where it lost sight of what the meaning was. So 2017, you introduced the term reintegrative therapy. Mm-hmm. How would you define reintegrative therapy?
Reintegrative therapy has a more precise definition, and it's basically a trauma treatment. It can be used for anyone. In fact, there was a study that came out recently, several months ago, in the Journal of Psychology and Psychotherapy, which looked at the treatment of using the reintegrative protocol for the treatment of binge eating for men and women. It found significant reductions in the binge eating. It was a pilot study, but reintegrative protocol could be used for all sorts of things. It can be used for heterosexuals. Just as somebody with heterosexuality versus homosexuality, it's the same treatment. It's just a trauma model, and other changes are the byproduct. So the binge eaters and the individuals in Carolyn's or Dr. Pela's study, they got the exact same treatment. It's just treating traumatic memories. So what is one part of your life that you'd want to explore? I'm going to vastly oversimplify it, but take something that you want to explore in your life, some reaction that you're having, and imagine it, get into it, feel it really intensely, let yourself feel the feeling, and now imagine going outside yourself, looking in your own eyes, and with a patient guiding therapist in a self-directed manner, the client is usually able to look in and see different layers of emotions, and we keep going until the client is able to identify whatever emotion he or she sees as the deepest. Then the therapist will invite the client to look back at earlier times that person has felt that way. And then whenever memories that the client identifies as traumatic are mentioned, then the therapist reprocesses them with some evidence-based trauma method. And therapists use a variety of methods. That's it. And then you go back to the original stimulus and say, okay, what's your reaction to it now? And people notice, the binge eaters, anyway, they just notice significant decreases as a spontaneous byproduct.